Hello, dear friends. Today's conversation is about fatty hepatosis. Fatty hepatosis, or steatohepatosis, is a widespread disease. It affects about 60 to 70% of people. Worse, it is spreading to children. It would seem to be a harmless disease, but in fact, 1 person in 10 will develop liver cirrhosis within 20 years, and cirrhosis is a one-way ticket to liver disease. What is steatohepatosis? It's a buildup of fat droplets in the liver. There are non-alcoholic and alcoholic steatohepatosis. We'll focus more on non-alcoholic steatohepatosis, but we'll also talk about the effects of alcohol. Fat droplets in the liver can accumulate for several reasons. The most obvious is an excessive intake of fat into the liver. The second reason is an insufficient breakdown of fat in the liver. The third is excessive synthesis of fat in the liver. And finally, the fourth reason is a lack of fat excretion from the liver. Excess fat intake to the liver occurs when the energy that comes to us with food exceeds our energy expenditure. It does not matter whether it is pure fat, carbohydrates, or mixed food. Our body still processes the excess energy into fat. As a result, the lipid composition of the blood changes, and the amount of free fatty acids and triglycerides circulating in the blood changes, get to the liver, and settle there in the form of reserves. Excessive synthesis of fat within the liver is caused most often by alcohol. Excessive entry of fat into the liver can occur regardless of food, for example, when a person is hungry. A paradoxical situation occurs. When a person is in a state of starvation, there is a breakdown of fats to feed the body. These products of fat breakdown, triglycerides, and free fatty acids circulate through the blood, get into the liver, and settle there. So thin people can also develop fatty hepatosis with insufficient energy intake. Fat excretion from the liver can be disturbed, either in case of lecithin deficiency, which means the lack of fat excretion with bile, or in case of violation of production of very low-density lipoproteins. There will be less of them in the blood, and all of it will remain in the liver. At first, fat droplets do not cause people any problems. They are present, and they don't do anyone any harm. But over time, fats in the liver begin to oxidize and, on the one hand, destroy liver cells, and on the other hand, contribute to the activation of Kupffer cells, such macrophages that exist in the liver. These Kupffer cells start producing pro-inflammatory substances called cytokines. Cytokines increase inflammation, and as a result, we get the next stage of the disease, hepatitis. Non-alcoholic steatohepatitis or alcoholic steatohepatitis occurs if the initial fat accumulation is caused by alcohol. Steatohepatitis is characterized by the fact that, in addition to inflammation, there are also areas of necrosis, that is, dead liver tissue. Gradually, these necrotic areas are replaced by fibrous tissue, and fibrosis begins to develop in hepatitis. Cirrhosis develops when fibrosis already reaches a critical point, and too many connective tissue fibers replace hepatocytes, in other words, liver cells. Cirrhosis is the development of connective tissue and its replacement of destroyed hepatocytes. With cirrhosis, there is already an increase in pressure in the portal vein system. The portal vein is a collector that collects blood from the digestive organs, and this vein flows into the liver. In addition to blood from the digestive system, the portal vein also contains blood supplied by the spleen. In liver cirrhosis, a frequent complication is increased pressure in the portal vein system, the development of esophageal varices, and subsequent bleeding from them. Since the esophageal veins have increased blood pressure, bleeding is often fatal. In cirrhosis, people die mainly due to bleeding associated with the enlargement of the veins. Very frequently, fatty hepatosis is a precursor of metabolic syndrome, or already exists against the background of the established metabolic syndrome. Let me remind you that metabolic syndrome is a complex of insulin resistance, dyslipidemia, high blood pressure, and obesity. In principle, the diseases fatty hepatosis and metabolic syndrome have common causes, and one may affect the other very much. How is fatty hepatosis diagnosed? At first, no changes in the blood are not observed. The diagnosis can be determined by ultrasound. As I've already said, 60% or maybe 70% of all patients have clear criteria for fatty liver dystrophy. Therefore, even a beginner doctor can determine the presence of fatty hepatosis. I can immediately tell from the person's appearance from the outside whether he has fatty hepatosis. I'm exaggerating a little bit. However, I am sure it is possible to determine hepatosis quite accurately. By the way, with many doctors, I can also immediately, by eye, determine fatty hepatosis. So, at first, there are no changes, and everything seems to be well, and people are happy. But over time, when steatohepatitis develops, there are changes in the blood. There's also an increase in ALT and AST. These are transaminases, enzymes that appear when liver cells are destroyed. Their increase signals that the liver is beginning to break down. In addition to transaminase changes, people with steatohepatitis may have elevated ferritin levels, a reactive protein. Our immune system will start to react, and some signs of inflammation will be seen. Ultrasound elastography is used to diagnose the degree of fibrosis. The essence of this technique is that with the help of a specific device, you can see how much the liver is affected by fibrosis and how close it is to cirrhosis. This method has a limitation: the person's weight and fat thickness. Therefore, there is a more accurate method of research, MRI and elastography. But of course, it will be much more expensive than a simple ultrasound. Treatment. Treatment of fatty hepatosis is 100% possible. There are already difficulties with the therapy of steatohepatitis, and there is no cure for cirrhosis. The only way out is a liver transplant. Let's talk about treating what can be treated. The treatment for non-alcoholic steatohepatosis is actually simple. It's the same as the treatment for metabolic syndrome. You can use pills, but I am not in favor of this, especially since such drugs as ursodeoxycholic acid, betaine, metformin, glucagon, and similar drugs are controversial, and we cannot say that they are a panacea in the treatment of this disease. Now, drugs that can reduce fibrosis in the liver are being developed and undergoing clinical trials, but they have not entered clinical practice yet. Therefore, the main thing in the therapy of steatohepatosis remains diet and exercise. First, you need to lose weight by at least 10%. It will give good results. It also helps very well to fight those factors that cause metabolic syndrome. That is, normalize insulin sensitivity, normalize the level of triglycerides, high, medium, and low-density lipoproteins, and naturally remove excess fat. In principle, all this is achievable and depends only on a person's motivation. I will talk a bit about the impact of diets on the therapy of steatohepatosis. I'll cite a March 2020 overview that examined the keto diet's ability to treat non-alcoholic steatohepatosis. Surprisingly, according to the review, the keto diet helped people to get rid of fatty liver infiltration. They attribute this to the fact that on a keto diet, the body begins to be adapted to eating fats and consequently to eating those fats stored in the liver and metabolizing them very quickly. There are different types of keto diets. I have made a review about the keto diet and sharing a link to a video about this review. So, there are two ways to treat steatohepatosis. It is a diet that leads to weight loss and exercise that also leads to weight loss. To avoid getting bogged down with specific diets, I have developed 3 main dietary rules that guarantee you will lose weight. I'll provide a link to these rules in the description of this video. That's it. Thank you so much for watching. Don't get fatty hepatosis. If you have it, be aware of the condition and get rid of it quickly. Stay healthy. Always for you, Dr. PopMed.